Welcome to this group presentation on the ecological model. Here we have a breakdown of the content we will be covering. I will introduce the ecological model. Jay will be providing an example of a research study which used this model to help prevent cardiovascular disease. And lastly, Quinn will discuss the importance of this model. According to the U.S. Department of Health and Human Resources, the ecological model is defined as the interaction between and interdependence of factors within and across all levels of a health problem. It highlights people's interactions with their physical and socio-cultural environments. The ecological model is distinguished from other health promotion models because of its emphasis on environmental levels of influence. It focuses on individual and social environmental factors as targets for health promotion interventions. It addresses the importance of directing change in individual, interpersonal, organizational, community, and public policy factors, while other models tend to lack emphasis on multi-level environmental influences. Behavior is viewed as being affected by and affecting multiple levels of influence. As stated on the slide, there are individual, interpersonal, organizational, community, and public policy factors. Another way of looking at this is that these factors can be divided into micro, meso, exo, and macrosystem levels of influence. The microsystem refers to face-to-face influences in specific settings, such as interactions with one's immediate family, informal social networks, or work groups. The mesosystem refers to interrelations among the various settings in which the individual is involved. These may include family, school, and peer groups. The exosystem refers to forces within the larger social system in which the individual is embedded. Examples might include unemployment rates, which affect economic stability. The macrosystem refers to cultural beliefs and values that influence both the microsystem and the macrosystem. Not only do each of these subsystems affect behavior, but the subsystems themselves may change as their members are replaced or altered. In short, here are the 4 core principles of ecological perspectives on health behavior change. Number 1, multiple levels of factors influence health behaviors. So factors at multiple levels, including individual, interpersonal, organizational, community, and public policy, influence health behaviors. And let's not forget the importance of socio-cultural factors as well as physical environments, which may apply to more than one level. Number 2, influences interact across levels. So the interactions of influences means that variables work together. Because ecological models specify multiple levels of influence, there are likely to be multiple variables at each level. It may be difficult to discern which of the possible interactions are most important. Thus, a challenge for research is to expand understanding of these interactions across levels. Number 3, multi-level intervention should be most effective in changing behavior. And then number 4, ecological models are most powerful when they are behavior specific. So ecological models appear most useful to guide research and intervention when they're tailored to specific health behaviors. Here's an example of the ecological model. As stated on the slide, it is a multi-level interactive approach. This model proposes that it is not sufficient to simply educate and encourage individuals for behavior change at the population level. Rather, it is more effective to make changes from the top down, where policy changes can have the broadest impact. In other words, we should focus on environments and policies that make it easier to make healthful choices, and then motivate and educate people about those choices. By focusing on multiple levels, simultaneous changes can lead to systemic changes. In summary, the ecological model helps us to understand how people interact with their environments. This understanding can guide the development of more effective and comprehensive population-wide approaches to improve health behaviors.
Now that we've covered the general principles of the ecological model, we can go over some applications of this framework and how it's been used for real-world health issues. One such example is Project HEART, a health initiative which piloted in the southern United States during the early 2010s. So what exactly is Project HEART? HEART, or the Health Education Awareness Research Team, was a study which aimed to promote cardiovascular health among Hispanic and Mexican American communities near the US and Mexico border. Researchers identified common health issues among these communities and saw that the rate of cardiovascular disease has been increasing in the past decade. They found obesity, diabetes, and hypertension to be some of the main contributing factors to this problem. Therefore, to address the issue, they sought to address these risk factors and to promote healthy behaviors in the form of physical activity and proper nutrition. Researchers chose the city of El Paso in the state of Texas for the study because the vast majority of residents were of Hispanic or Mexican origin, and the city itself is located directly on the border. Furthermore, the city demonstrated lower than average median income and a greater proportion of residents without health insurance. This made it the ideal location to conduct the study. People of low socioeconomic status were the primary targets as they were less likely to access community health services. This is probably because recreational facilities often require membership fees and time commitments, both of which deter people who are already busy or are looking to spend their money more frugally. The intervention that was implemented was called Mise Mise, an acronym for a Spanish phrase which translates to My Heart, My Community. This name is fitting since the intervention intends to implement local services and facilities to improve cardiovascular health for the entire community. The programs within this intervention, in terms of physical activity, include exercise classes, family sports, and walking groups. For the nutritional side of things, they include cooking demonstrations and grocery store tours. Now, referring back to the ecological model, Project Heart framed much of its design around the various levels of influence. For instance, the researchers accounted for the fact that most of the participants were native Spanish speakers by having bilingual community health workers coordinate the activities. They would also help bridge the cultural gap between the Mexican American participants and the American policymakers. So, using the model, they were able to accommodate for the key agents of the individual level, the participants, through other levels of the program. Another important influence is the organizational level, in which many organizations and partners worked in unison to provide the activities for the participants. For example, the YWCA was a key partner for the success of the intervention as they provided access to its local recreational facilities. This gave participants the opportunity to exercise and play freely without worrying about membership costs. And so this organization was crucial for the physical activity aspect of the intervention. Overall, the project implemented many of the ideas of the ecological framework to better suit the needs of the entire community. So here are the results. Overall, the study found that self-reported health behaviors had improved. This meant that participants claimed to exercise more, eat more fruits and vegetables, and smoke less. Furthermore, weight was found to be lower than what was measured at baseline. So the program did yield noticeable results. However, these results weren't really considered clinically significant as they didn't affect the overall risk of cardiovascular disease. But we do need to keep in mind that this program was a pilot, which had only lasted for 4 months. A longer intervention period may yield better results. So it seems that the use of the ecological framework did benefit this study as it helped to incorporate many aspects to address the common issues of cardiovascular disease. By restructuring the pre-existing services and facilities in the community, more of the population were able to benefit from them. Although it's unknown if many of the participants could afford to continue these memberships, this program did help to educate and raise awareness of possible health behaviors for better cardiovascular health.
The term CVD encapsulates all of the following diseases: coronary heart or coronary artery disease, cerebrovascular disease, which include strokes or transient ischemic attacks, peripheral artery diseases, rheumatic heart disease, and congenital heart failure, for which common risk factors include high blood pressure, the use of tobacco and alcohol products, drug use, physical inactivity, body mass index, and ethnic background, which is largely due to the systemic inequities faced by non-white minorities in the United States. On average, ethnic minorities, including Hispanics in this case, are more likely to belong to lower income and less educated groups who have a reduced access to health resources. Cardiovascular diseases can result from many lifestyle and genetic factors. Even those who do everything in their power to eat properly, get enough exercise and sleep, those who listen to their doctor and eliminate all of the negative stresses in their lives are still at risk of developing CVD. Why it is important in this context to use the ecological model is because the subjects being followed are from a low-income and ethnically marginalized group, and for this reason, they are being exposed to even more factors than would a member from a majority group. As seen in this diagram, it is important to realize that there are aspects at each level of the model which increase the possibility of a member of this group developing CVD. In this example, factors at the public policy level include the health inequities faced by marginalized groups, in addition to the inexpensive and therefore inaccessible health insurance in the US. At the community level, the Hispanic population in this region is faced with high levels of poverty as well as discrimination from non-ethnic groups, which poorly reflect on their health. At the organization level, they average a lower quality of education. Interpersonally, the Hispanic population in El Paso might be exposed to transgenerational health habits like poor diet, low exercise, and smoking, which can have negative health effects. And finally, they might also lack the motivation to better their own health promoting behaviors. When we're talking about health outcomes like cardiovascular disease, we need to acknowledge that there should be an importance placed on both health promotion as well as disease prevention. As time goes on, our life expectancies are continuously increasing, and as such, the health complications we face are also changing, from infectious in nature to being more accurately described as issues of wear and tear. In the 1940s and 50s in the United States, the most common causes of death were pneumonia, tuberculosis, and other infectious diseases, whereas currently the leading cause of death is CVD, where it is responsible for 1 in 4 of all deaths. And this number is even higher in the Hispanic community. Living longer means more progressive buildup of arterial plaques, causing high blood pressure, which is a common factor of CVD. However, the process of accumulation can be mitigated with lifestyle factors. The dichotomy of CVD genesis would best benefit from a combination of health promotion and disease prevention, acknowledging that we can do what we can, but we can't always avoid it. Since nature and nurture both play a role in the development of CVD, regardless of how many health promotion techniques are implemented, disease can still arise and treatment measures should be in place to catch the cases that do occur.